Are you and your spouse struggling to conceive? You're not alone. It's an issue that, believe it or not, affects a significant number of couples worldwide. Fertility issues, the silent struggle that many endure, often behind closed doors, are far more common than you may realize. So what's going on? Well, the reasons can be as unique and varied as we are as human beings. For some, it might be due to a lower sperm count. A man needs a certain number of healthy motile sperm to fertilize an egg, and sometimes the count just isn't high enough. But it's not always about quantity. Quality matters too. The shape, movement, and overall health of the sperm can significantly impact fertility. For others, the problem could lie in irregular ovulation. This is when an egg isn't released from the ovaries regularly or at all. Without an egg, there's nothing for the sperm to fertilize, making conception impossible. Conditions like polycystic ovary syndrome, or PCOS, can often be the cause of these irregularities. Then, there are the more complex cases where a combination of factors from both partners is causing the fertility issues. This is called unexplained infertility, a term that often leaves couples feeling helpless and confused. But here's the thing you need to remember. This struggle, as personal and isolating as it may feel, is one that you share with millions of other couples. There's no shame in facing fertility issues. It doesn't make you any less worthy or capable of being amazing parents. It's just a hurdle, a challenge that you, like many others, are facing on this journey to parenthood. And the good news? You're already on the right path. Understanding the problem is the first step towards finding a solution. You're taking that step right now, so don't lose hope. There are answers out there, and together, we're going to find them. Because every journey, no matter how difficult, begins with a single step, and you've just taken yours. Did you know that timing plays a crucial role in conception? It might seem like a simple detail, but it's an essential piece of the puzzle when it comes to successful conception. Firstly, let's dive into the basics of a woman's menstrual cycle. A standard cycle lasts about 28 to 30 days, but it can vary from woman to woman. This cycle is divided into various phases, and the fertility window typically falls within the ovulation phase, which is roughly in the middle of the cycle. During ovulation, an egg is released from the ovaries. This egg then travels down the fallopian tube, where it can be fertilized by sperm. The egg is only viable for about 12 to 24 hours after its release. However, sperm can survive in the female reproductive system for up to 5 days. Now here's where the timing comes into play. The optimal time for conception is usually a few days after the completion of the menstrual cycle. This is when the woman is most fertile, and the chances of the sperm meeting the egg are highest. It's like aligning the stars, but in this case, it's aligning the egg and sperm. Keep in mind that every woman's cycle is unique. Therefore, understanding the rhythm of your cycle is essential. There are various ways to track your menstrual cycle, such as using a calendar, an app, or observing changes in your body. Remember, timing is just one aspect of conception. There are other factors at play, including the overall health and well-being of both partners. But getting the timing right can significantly increase your chances of conception. It's like planting a seed. You need to do it at the right time for it to grow. So the takeaway here is this. Understanding your cycle and timing can significantly increase your chances of conception. It's not the only factor, but it's a crucial one. And with this knowledge in hand, you're already one step closer to welcoming a new addition to your family. Now let's talk about a common concern, low sperm count. Boosting sperm count may seem like a daunting task, but fear not, there are various methods that can help. One of the fundamental ways to increase sperm count is through maintaining a healthy diet. Consuming nutrient-rich foods such as fruits, vegetables, whole grains, and lean proteins can have a positive impact on your overall health and, by extension, sperm production. Exercising regularly is another crucial step in enhancing sperm count. Regular physical activity can improve circulation and overall health, which can help increase the number of healthy sperm. So, whether it's a brisk walk in the park, a gym session, or a yoga class, make sure to keep your body moving. It's also important to consider what you need to avoid. Harmful substances like alcohol and tobacco can significantly decrease sperm count. Reducing or eliminating these substances from your lifestyle can contribute to a healthier and higher sperm count. Now, you might be wondering about the role of certain medicines and supplements in boosting sperm count. Some studies suggest that supplements like folic acid, zinc, and coenzyme Q10 may enhance sperm count. There are also medications that can help address specific issues related to low sperm count. For instance, certain hormone treatments can stimulate the production of more sperm. But here's the thing. While these methods can potentially improve sperm count, they're not a one-size-fits-all solution. Everyone's body is unique, and what works for one person may not work for another. That's why it's always best to consult your healthcare provider before starting any new medication or supplement. They can provide personalized advice and guide you through the process, ensuring that any changes you make are safe and effective. They can also help identify any underlying health issues that may be contributing to a low sperm count. So, take a deep breath and remember, boosting sperm count is not a sprint but a marathon. It's all about making consistent, healthy lifestyle choices and seeking professional guidance when needed. Remember, it's always best to consult your healthcare provider before starting any new medication or supplement. Folic acid. It's not just for women trying to conceive. This vitamin is a powerhouse that benefits both men and women. For the ladies, it's a well-known aid for the healthy development of the baby's neural tube. But gentlemen, listen up. Folic acid is your ally too. It works behind the scenes to improve sperm health, increasing the chances of a successful conception. You see, folic acid plays a crucial role in DNA synthesis and repair. Sounds technical, right? But in simpler terms, it ensures the genetic code carried by your sperm is in top-notch condition, helping to reduce the chances of birth defects. And it's not just about conception. Folic acid also contributes to overall health. It assists in the production of red blood cells, helping to prevent anemia. Getting enough folic acid is as easy as incorporating foods like leafy greens, citrus fruits, and fortified cereals into your diet. So don't forget to include folic acid in your diet. Pregnancy is a beautiful journey, but it also requires certain precautions. As we navigate this remarkable period of life, it's crucial to adopt certain measures to ensure the health and well-being of both the mother and the unborn child. Firstly, regular prenatal checkups are a non-negotiable part of a healthy pregnancy. These visits allow healthcare professionals to monitor the progress of the pregnancy and the baby's development. It's also an opportunity to screen for potential complications, ensuring that any issues are promptly addressed. Next, maintaining a balanced diet is vital. This isn't just about eating for two, it's about providing the necessary nutrients for your baby's growth and development. Include a variety of fruits, vegetables, lean proteins, and whole grains in your diet. Adequate hydration is also essential, so don't forget to drink plenty of water. Now let's talk about what to avoid. Certain foods and activities can pose risks during pregnancy. For instance, unpasteurized dairy products and undercooked meats can carry bacteria that might be harmful to your baby. High-mercury fish, like swordfish and king mackerel, are also best avoided. When it comes to activities, high-impact sports or exercises that involve a risk of falling should be replaced with safer alternatives such as swimming, walking, or prenatal yoga. It's also important to maintain a healthy lifestyle overall. This means quitting smoking, avoiding alcohol, and refraining from the use of illegal substances. Regular, moderate exercise is beneficial, but should be done under the guidance of a healthcare professional. Remember, all pregnancies are unique. What works for one may not work for another. Therefore, it's crucial to keep an open line of communication with your healthcare provider, following their advice tailored to your specific needs. In conclusion, taking precautions during pregnancy is not just about avoiding potential pitfalls, but also about promoting a healthy lifestyle that benefits both mother and baby. After all, taking care of yourself during pregnancy is the first step in taking care of your baby. After pregnancy, a new journey begins: parenthood. This journey, while rewarding, comes with its own set of challenges, especially in the form of common baby problems. One such problem is colic, a condition characterized by frequent, prolonged, and intense crying or fussiness in an otherwise healthy baby. While it can be stressful to manage, know that this is a phase and it gets better over time. Then we have diaper rash, an irritating skin condition that can cause discomfort for your little one. It's usually due to prolonged exposure to a wet or soiled diaper. Regular diaper changes and using barrier creams can help manage this issue. Feeding difficulties are also common in babies. Whether you're breastfeeding or bottle feeding, it's important to find a comfortable position for both you and your baby. And remember, patience is key during feeding times. Remember, every baby is different, and it's okay to ask for help.